Surprise, shawty!
This person's been having headaches, and then they found out they had a baseball-sized tumor inside of their brain. These are the top 5 symptoms of a brain tumor. Number 5 is some sort of numbness and weakness that is affecting a particular part of the body that is consistent and ongoing. This was reported by up to 33% of individuals with a brain tumor. Just depending on where the tumor is located within the brain, it can manifest itself as numbness, tingling, and potentially even a motor deficit. Number 4 is nausea. Up to 38% of individuals with a brain tumor report having consistent nausea and vomit. And that's because space-occupying lesions within the brain can sometimes increase the pressure inside of the head and can lead to things like nausea and vomiting. Number 3 is seizures. Up to 60% of individuals with a brain tumor have reported some sort of new onset seizure. This is more likely to be seen in tumors that are located on the outside surface of the brain. And number 2 is headaches. Up to 71% of individuals that have had a brain tumor did report they've had some sort of headache. The literature states that it's most oftentimes reported as a tension type headache, which starts at the base of the neck, works its way up the back of the head towards the front part of the forehead, almost like a headband. And the number 1 symptom of a brain tumor reported by the literature is some sort of cognitive or behavioral change. Up to 91% of individuals did report changes in their ability to think and in their behavioral pattern, which impacted their day-to-day life. This includes things like brain fog as well. Now, oftentimes these are symptoms that are pretty benign and don't really require much workup because they'll resolve on their own. But there are instances where you have enough symptoms that kind of come together to give you a more of a warning picture that requires further workup. More than one of these symptoms that is present for a long period of time should trigger some sort of further investigation. It's important to listen to what your body's telling you because sometimes that could be the sign that you need to stop the disease from progressing.